If you've been sleeping on your back for years, thinking it's the healthiest way to rest, what if I told you that this very position might be quietly interfering with blood flow to your brain every single night? For decades, back sleeping has been recommended by everyone from orthopedists to sleep specialists. It's supposed to protect your spine, prevent wrinkles, and keep everything aligned. And in many ways, those benefits are real. But here's what almost nobody talks about, especially when it comes to adults over 60. The supine position, lying flat on your back, creates a specific set of cardiovascular changes that can increase stroke risk in ways most people never see coming. Not because the position is inherently dangerous, but because of how aging blood vessels, cardiac output, cerebrovascular drainage, and respiratory function all shift after age 60. And when those systems are already vulnerable, sleeping position becomes far more than a comfort issue. It becomes a vascular event waiting to happen. Let me be very clear about something. This isn't about fear. This is about understanding what's actually happening inside your body while you sleep, so you can make informed choices that protect your brain. Because after 60, stroke risk climbs sharply. 1 in 4 adults over 60 will experience a stroke or transient ischemic attack in their lifetime. And while we often focus on cholesterol, blood pressure, and diet, we rarely talk about the 8 hours you spend horizontal, when your cardiovascular system is operating under very different mechanical pressures than during the day. What you're about to learn may challenge what you thought you knew about healthy sleep, but it's rooted in cardiovascular physiology, clinical research, and decades of surgical observation. And most importantly, it's something you can adjust tonight. Here's what's really happening when you sleep on your back, especially after 60. Your cardiovascular system doesn't shut down at night, it shifts. Blood pressure drops slightly, heart rate slows. But the work of circulating oxygen-rich blood to your brain and draining deoxygenated blood back to your heart continues around the clock. In younger adults with flexible vessels and strong cardiac output, sleeping position matters less. The system adapts. But in older adults, the margins get narrower. Vessel walls stiffen. Cardiac output declines. The autonomic nervous system becomes less responsive to positional changes. And suddenly, how you position your body during sleep starts affecting how efficiently your brain gets oxygen and how effectively waste products are cleared from neural tissue. When you lie flat on your back, several things happen simultaneously. First, your cardiac output increases compared to side sleeping. That might sound like a good thing, but higher cardiac output in the supine position also means increased sympathetic nervous system activation. Your body goes into a slightly higher stress mode even while you're unconscious. Blood pressure rises modestly. For someone with already stiff arteries or borderline hypertension, that modest increase can push pressures into a range where vessel walls experience micro damage over time. Night after night, year after year. That micro damage is where plaques form, where clots develop, where strokes begin. Second, and this is critical, the jugular veins that drain blood from your brain behave very differently depending on your position. In the supine position, these veins dilate and handle the majority of cerebrovascular drainage. Your brain produces metabolic waste constantly, including proteins that need to be cleared efficiently to prevent neuroinflammation and vascular stress. When jugular drainage is optimal, this system works beautifully. But here's the problem. In older adults, especially those with any degree of cervical spine degeneration, neck muscle tension, or arterial stiffness, lying flat can subtly compress or restrict jugular flow. Not enough to cause immediate symptoms, but enough to create a slight backup of venous pressure in the brain. Over time, this venous congestion contributes to increased intracranial pressure, disrupted lymphatic clearance, and a higher likelihood of vascular events, including stroke. Third, back sleeping significantly worsens sleep apnea, and sleep apnea is one of the most under-recognized stroke risk factors in older adults. When you lie on your back, gravity pulls the soft tissues of your throat backward. Your tongue falls toward the back of your airway. Even if you don't have diagnosed sleep apnea, this positional obstruction can create repeated drops in blood oxygen levels throughout the night. Each time your oxygen dips, your brain experiences a micro-stress event. Blood vessels constrict, blood pressure spikes, inflammatory markers rise. Do this hundreds of times per night, and you're essentially bathing your brain in a low-grade ischemic environment. Research shows that untreated sleep apnea, especially in the supine position, raises stroke risk by up to 70% in older adults. 70%. And most people have no idea it's happening because the symptoms are invisible. You just wake up tired, foggy, maybe with a headache. You assume it's age, but it's your brain being starved of oxygen repeatedly while you sleep. Now let me explain why this becomes exponentially more dangerous after age 60. It's not just about one system failing, it's about multiple systems losing their buffering capacity at the same time. When you're younger, your vessels are elastic. They expand and contract easily to accommodate changes in pressure and flow. Your heart pumps with more force. Your autonomic nervous system responds rapidly to keep blood pressure stable when you change positions. But as you age, arterial compliance drops. The vessels become rigid. Cardiac output declines by roughly 1% per year after 60. The baroreceptors that regulate blood pressure become sluggish. This means your body can no longer compensate as efficiently for the cardiovascular stresses of supine sleeping. What was once a minor increase in sympathetic tone or a slight reduction in jugular drainage now becomes a sustained mechanical stress that your aging vascular system can't buffer. That's when the risk escalates. Think of it this way. Imagine a water pipe that's been in service for decades. When it's new, it can handle fluctuations in pressure. The material flexes. But after years of use, the pipe becomes brittle. Now even small pressure surges can cause cracks or ruptures. Your blood vessels after 60 are like that aging pipe. Back sleeping creates pressure surges and drainage inefficiencies that a younger, more flexible system could absorb. But in an older system, those same stresses accumulate. Micro-injuries to vessel walls, inflammatory responses, plaque formation, clot risk, eventually a stroke. And here's what makes this so insidious. You feel nothing. There's no pain, no warning. You go to bed feeling fine. You wake up feeling normal, maybe a little tired. But beneath the surface, your brain's vascular system is under strain. Night after night, the cumulative damage builds, until one night a clot forms, or a vessel ruptures, or a critical artery becomes occluded. And suddenly, you're facing a life-altering stroke that could have been prevented by something as simple as changing your sleep position. Let me share what happens in the hours before most strokes occur. The highest risk window is between 4 a.m. and 8 a.m. Why? Because during the later stages of sleep, blood pressure begins to rise in preparation for waking. Heart rate increases, platelet activity surges. In someone sleeping on their back with compromised jugular drainage, elevated intracranial pressure, and recurrent apnea-related oxygen drops, this early morning cardiovascular surge becomes the perfect storm. The vessels are already stressed, the blood is already prone to clotting, and then the body ramps up pressure and flow. That's when strokes happen, in the quiet hours of dawn, while you're lying flat, completely unaware. Now, before you panic and think you need to avoid your back entirely, let me give you the full picture. Because this isn't about never sleeping on your back. It's about understanding when and how back sleeping becomes risky and what you can do to modify that risk. For some people, especially those with certain spinal conditions, back sleeping with proper support may still be appropriate. But for adults over 60, especially those with any history of high blood pressure, cardiovascular disease, diabetes, or unexplained morning fatigue, the evidence strongly suggests that side sleeping, particularly on the left side, offers significant vascular protection. Here's why left side sleeping matters. When you sleep on your left side, you position your heart higher than the rest of your body. This reduces the workload on your cardiac muscle and improves the efficiency of blood return to the heart. The aorta, your body's main artery, arches to the left. When you lie on your left side, gravity assists rather than opposes blood flow through this critical vessel. Jugular drainage also improves in the lateral position because there's less compression on the neck veins. Your airway stays more open, reducing apnea episodes. And importantly, sleeping on your left side reduces the likelihood of gastric reflux, which may not seem stroke-related, but actually is, because chronic reflux creates systemic inflammation that damages vessel walls over time. Research on sleep position and cardiovascular health has shown that individuals who sleep predominantly on their left side have fewer episodes of angina, lower nighttime blood pressure, and better cerebral perfusion compared to back sleepers. Cerebral perfusion, that's the amount of blood your brain receives. And in older adults, maintaining optimal brain blood flow isn't just about preventing stroke. It's about preserving cognitive function, memory, and independence. Poor perfusion over time leads to vascular dementia, silent strokes, white matter lesions, and progressive cognitive decline, all of which are influenced by how you sleep. But here's the problem. Most people don't stay in one position all night. You might start on your side and end up on your back by morning. Or you might wake up multiple times and unconsciously roll to whatever position feels most comfortable in that moment. And comfort is important. Sleep quality matters. If you force yourself into a position that causes pain or frequent waking, you're trading one health risk for another. So the goal isn't rigid adherence to one position. The goal is to gently encourage lateral sleeping and minimize the amount of time spent flat on your back, especially during those high-risk early morning hours. Here's how to do that practically. First, if you currently sleep on your back, try placing a firm pillow behind you when you go to bed on your side. This creates a physical barrier that makes it harder to roll onto your back during the night. It's not foolproof, but it significantly reduces back sleeping time. Second, elevate the head of your bed by 4 to 6 inches. You can use risers under the bed frame or a wedge pillow under your mattress. This slight incline reduces the gravitational pooling of blood in your brain and decreases the likelihood of apnea episodes, even if you do end up on your back. Third, if you have diagnosed sleep apnea or suspect you might, get tested. A simple home sleep study can confirm whether positional therapy or a CPAP device is needed. Treating apnea is one of the most powerful stroke prevention strategies available, and it works synergistically with sleep position changes. Fourth, pay attention to your pillow. Many people use pillows that are too flat or too high, which forces the neck into awkward angles that compress jugular veins even when sleeping on their side. Your neck should be in neutral alignment, a straight line from your spine through your skull. For side sleepers, this usually means a thicker, firmer pillow that fills the space between your shoulder and your head. For back sleepers transitioning to side sleeping, this adjustment is critical. Fifth, consider your mattress firmness. A mattress that's too soft allows your hips and shoulders to sink, which twists your spine and can still compromise vascular flow even in a lateral position. Medium firm support is generally optimal for maintaining proper alignment and circulation. And here's something most people overlook. What you do in the hour before bed affects your vascular system while you sleep. If you eat a heavy meal late at night, your digestive system pulls blood flow away from your brain during sleep. If you consume alcohol, it disrupts the normal sleep architecture and worsens apnea. If you take certain medications without timing them properly, they can cause blood pressure fluctuations during the night. These aren't separate issues from sleep position. They're part of the same cardiovascular equation. Everything compounds, or everything protects. It depends on the choices you make. Let me be clear about what this means for you. If you're over 60 and you've been sleeping on your back without symptoms, this doesn't mean you're doomed. It means you have an opportunity to reduce a risk factor you may not have known existed. If you wake up with headaches, brain fog, fatigue, or dizziness, and you sleep on your back, this could be a significant contributor. And if you have known cardiovascular disease, a history of stroke or mini-stroke, or multiple risk factors like diabetes and hypertension, then modifying your sleep position isn't optional, it's essential. Because at that point, every marginal gain matters. Every small change that reduces vascular stress, improves oxygenation, or enhances waste clearance from the brain is a step away from catastrophic events. This is not about restriction, it's about precision. You're not eliminating a position because it's inherently bad. You're choosing a position that optimally supports your aging cardiovascular system. You're working with your physiology, not against it. And the beautiful thing is, once you adjust, most people find that they actually sleep better on their side. Fewer waking episodes, less snoring, more restorative sleep. Because when your brain is getting adequate oxygen and efficient waste removal, sleep quality naturally improves. So tonight, when you go to bed, try this. Lie on your left side with a pillow supporting your neck in neutral alignment, and another pillow between your knees to keep your hips level. Place a firm pillow behind your back to discourage rolling. And if you wake up on your back, don't stress, just roll back to your side. Over time, your body will adapt. The position will feel more natural, and you'll be giving your brain the best possible environment to stay healthy, protected, and stroke-free. Because sleep isn't just rest, it's repair, it's detoxification, it's vascular maintenance, and after 60, every hour of sleep is either supporting those processes or subtly undermining them. The position you choose matters more than you ever realized. Not because it's complicated, but because it's cumulative. Small stresses over decades create big outcomes. Small protections over decades create resilience. You get to choose which path your brain takes. If this kind of science-based, practical guidance resonates with you, consider subscribing. I create content every day to help you understand your body's signals, protect your metabolic and cardiovascular health, and make decisions that preserve your independence and longevity. Because the goal isn't just to live longer, it's to live stronger, sharper, and more capable for as long as possible. And that starts with the choices you make tonight, in the quiet hours when your body is repairing itself and your brain is depending on you to position it for success.